Hello, this is Dr. Clark from the Center for Weight Loss Success, and today I want to talk a little bit about diabetes. Now, diabetes is actually two different disease processes. There's diabetes type 1, but also diabetes type 2. Now, actually, about 85 to 90% of diabetics are actually diabetes type 2. But diabetes type 1 is very important. It's often thought of as juvenile diabetes or early onset diabetes, where those people, they don't make any insulin at all. And if you don't make any insulin at all, you actually cannot store fat. So one of the diagnosis criteria is that people lose weight very easily. Often their blood sugars go extremely out of control. They end up in the hospital in ketoacidosis, which is a life-threatening problem. But the treatment there is they actually have to take insulin because they don't produce any insulin. Now, the other extreme is actually diabetes type 2. Diabetes type 2 is actually a completely different disease process, but it's the most common form. And this is what we see when people are gaining weight, because diabetes type 2 means you're generally resistant to insulin. You make plenty of insulin, but you're just resistant to the actual insulin itself. And what happens is blood sugars start to go up and insulin levels also are going up. The insulin not only helps control your blood sugars, but it also makes your body store fat. And your body doesn't have any choice. Insulin, that is a hormone that tells your body to store fat. So you can't prevent it from happening. But what you can do is help prevent the blood sugars from going up. If you prevent the blood sugars from going up, then insulin levels will typically settle back down. It'll make it easier to lose weight. How do you prevent blood sugars from going up? Well, that's fairly easy. You actually have to avoid eating the things that make your blood sugar go up. And that's simple carbohydrates, and a lot of the carbohydrates such as pasta, rice, potatoes, and bread. Or the chips, the cookies, the crackers, the cereal. You want to kind of stick with what I'll call healthy carbohydrates, which is generally colorful vegetables and salad type of things. Looking for more tips? Go to our website, www.cfwls.com. It's your life. Make it a healthy one.